Welcome to the OCOM Podcast, Modern Medical Education, where we gather experts to discuss various topics in modern medical education, with the focus of today's show being on leadership for physicians. I'm your host, Dr. Robert Hasty, Dean and Chief Academic Officer of OCOM, and I have two of our awesome leaders from OCOM here today. First being on my left, Dr. Robert Minkus, MD, PhD, Chair of Specialty Medicine. Welcome to the show, Dr. Minkus. How are things going in the Department of Specialty Medicine?
Yeah, things are going great. Who could ask for anything more, especially from a leadership role, being part of an amazing team and organization where we were able to launch a brand new medical school and develop curriculum and have really engaged faculty. So it's going great.
I'll tell you, we're so lucky to have you here. And Dr. Minkus actually literally flies around the country and consults for even other medical schools, even one that I used to be at. In terms of consulting for excellence and leadership, and really could not have had somebody else that had your kind of experience and knowledge in terms of training leadership for the next generation of physicians. So it's so nice to have you here.
Yeah, thanks so much.
Yeah, and to my right is Dr. Oshakoya, MD, Chair of Primary Care. Welcome to the show, Dr. Oshakoya. How are things going into the Department of Primary Care?
Thank you so much. Things have been going really, really well. The primary care team is fantastic. We have just the best faculty in this organization, and I'm so grateful and honored to have the opportunity to work with them and help build this new curriculum for our students.
Excellent. And by the way, congrats again. While we're on the podcast about no longer being the interim chair of primary care, you're the permanent chair of primary care. Although I sent out, that you're no longer the interim chair of primary care, and people said she was interim, because doing such a great job. Everybody just assumed that you were the permanent chair of primary care. So terrific job, and what a great, all of our both of our departments, or actually all three of our major faculty departments are really the best I've ever seen. Mm-hmm. And in fact, I always tell people all the time that we're blessed here. Out of all the medical schools I've either been a part of or visited, this is the best medical school faculty and staff I've ever been part of. So we're very, very fortunate to have both of you here in your leadership. So anyway, we're talking about a topic that in medical schools, wasn't always talked about historically. And, the assumption is once you graduate medical school, you're a physician, and people just assume that because you're a physician and in terms of, your knowledge and everything on the team, that you're automatically a leader. But I graduated medical school in 2000, and I can tell you, I had zero leadership training, formal leadership training. And then I went on to residency and eventually became a chief resident. And again, I still had zero formal leadership training. And so, certainly since then I've had a lot of formal leadership training and a lot of on-the-job training too as a leader, which I think so too. But that's always been sort of the norm, right? I don't know if your experiences are somewhat, similar or different to mine. Yeah.
Very similar. I didn't have formal training during medical school. I did get a master's in health administration, so there was some level of leadership training there. But during residency, and when you think about physicians, when we graduate, we instantly become leaders of a team in some ways, and so I think it is extremely important that we participate in, formally learning how to be a leader. As that's really a characteristic that is that you can learn and that you can build upon.
Excellent. Yeah. How about you?
Yeah, no, a similar experience. And as physicians, and if you have some type of academic and clinical success, there's a need. So people look to you for your first leadership positions. And so without any of that training, you're thrown into it, and you might do great or you might not do as well unless you have some sort of mentorship or training. So thankfully, we've recognized that there is a growing need, and there is a skill set that we can gain even in medical school to start growing those skills and competencies so others see us in a different light. And we also identify as leaders, which is an issue as physicians. It's a transition to identifying as a leader.
And I think that it's important for all physicians to have those leadership skills. Whether or not you're working with a team in an emergency department, an operating room like Dr. Minkus, a pediatric surgeon. I'm a hospitalist, working, with a hospitalist team. So is Dr. Oshikoya, or, maybe in a, private practice somewhere. Or also what's growing so much is this huge field of physician leadership in terms of professional physician leaders. Obviously, I'm a dean of medical school. I spend most of my day, actually almost all my day, in administrative type of activities. But I can tell you that there was a white paper about 13 years ago, that showed that if a hospital or healthcare system was a physician, the hospital system actually had better outcomes, both in terms of quality, which I think some folks would predict, but also in terms of financial outcomes. And I know since then, there's been somewhat of a rebound or an increase in terms of, physicians that are leaders in those areas. And then, of course, every hospital and healthcare system, or it seems like every hospital and healthcare system, has a chief medical officer, a chief medical informatics officer, for overseeing the electronic health records and those type of datas. And now, actually, I've been watching the University of Miami. Now they've created a chief AI officer for artificial intelligence. And so and I know that Advent Health, which is the largest hospital system in Florida, just hired, I believe, their first chief of AI officer. And I know the other hospital systems are doing other things. So it seems like the demand is definitely there, right?
Absolutely. I think the part of it is that physicians are on the ground in the beginning of their training, and they understand what is needed, and they understand the challenges. And so as you create leaders by giving them formal, leadership opportunities, then you allow those individuals to really be able to see with a different lens what the organization needs and be able to save and help the organization grow.
Excellent. Well, one thing I'm super excited to hear about is our first inaugural cohort of medical students going through leadership training here at OCOM. And I actually, sat through a little bit of that the first session recently. And I'll tell you, it was pretty amazing, medical students, first-year medical students getting, formal leadership training, which I thought was pretty interesting. So I don't know if either of you want to, tell me a little bit more about that.
Yeah, I'd love to start with that. So with some of our background in leadership and some formal training, working as a team to develop a program for students is an amazing opportunity. So partnering with Associate Dean Odell and the Department of Student Affairs and her staff on identifying what the need is from their perspective and what our need is, knowing what our students are going to benefit from down the line, really created an incredible opportunity for Dr. Oshikoya and I to partner in really developing something very specific that's directed towards growing those skills, right? What are the leadership skills that others will see, hear, and feel that go beyond the didactics? We're pretty good at reading books and can say this is a leadership style, but actually practicing those skills and developing them is an incredible opportunity with this incredible inaugural class.
Yeah, excellent. And what type of skills are you mostly focusing now on, the first-year medical students in terms of leadership training?
Yeah, I think one of the biggest thing for this leadership training that we're doing is really focusing on their emotional intelligence and really helping them learn how to communicate effectively and really understand and lead with empathy in their communication style. I think that's one of the great things about OCOM, right, is that we are very innovative in that way. We really try to find places and we try to find things that will lead our students into better physicians who are caring, compassionate, but also leaders in their field and everything that they do. And so I think it's been really great that we've been able to start this program and really help build their skill in that way.
Excellent. Yeah. And I'm a big believer that, of course, if you look up the definition of what an expert is, that, one definition is expert is the master of the basics. And I think, for leadership skills, right, you have to have those basic leadership skills. Like you mentioned, communication. I know that in their, conflict resolution, leadership, presence, all these, type of things that are super important. And of course, you mentioned emotional intelligence. Part of that, a lot of times people will call the soft skills. But I am convinced, I've actually had this conversation with Dr. Hill, that the soft skills are really the hardest skills, I think, sometimes to get. And, applying to medical school and, taking the MCAT and stuff like that, a lot of that, except maybe for the interview for medical schools, is really, not really in the soft skill domain, right?
Yeah, no, absolutely. I've transitioned my verbiage to core human skills, right? They're core human skills, and soft is quite a misnomer because they can sort of make or break your entire culture and your environment. And so to be where we are benefiting from small group learning, where the students learn to work in small groups, which they're going to see as they move forward, developing those skills even of listening. I mean, if I go back to my journey, a decade or so ago, I mean, the first audiobook I ever got was on improving my listening skills because I realized I didn't listen. I was one of those, ready for a thought to do a backflip off my tongue before you even were halfway through what you had to say. So becoming mindful, and we've built a model, like our model and framework for the students to learn is based on a coaching as a leadership model, which requires their skills of listening, reflection, and then adding something, and then asking a question. So it really begins with us as self-awareness, that piece, and then includes open-mindedness and knowledge. It's not only what we learn, but what we have to unlearn. And then what are the skills we need to develop? And then really practicing and reflecting and getting feedback to improve. And that fits into our lifelong learning model here at OCOM.
Excellent. And I like that core human skills, right? That's like, if you could master, I don't know, and that's a good question. And maybe you guys, do this as part of the, the leadership training. But, there's probably a certain, top 5 leadership skills that, that I think really to be successful, that you really kind of have to master those, the top 5. Now there's probably 15 arguably, core leadership skills, right? But I don't know, what are the ones that you guys are focusing on mostly in the course?
So to begin with, it's a well-designed course that is built around that framework. But even in the beginning, it's listening and even basic improv practice, the yes and, it's all behavioral based, right? What can they do in practice behaviorally to make a difference? And that requires oftentimes working outside of our comfort zones, working with people who have different styles, different backgrounds, and different ways of thinking. And so that approach really at the beginning helps. So we're having a 4-part summary. We had our first one. The second one now is building upon what their strengths are. It's a strengths-based approach, a positivity or positive psychology approach, and then allowing our student leaders to determine how they want to be seen, heard, and felt. And that goes into their brand. What is their brand? And the final 2 is, as they build their brand, how do you lead yourself? And then how do you lead others? And that starts to get into the teamwork domain. So those skills, if you go back to what Dr. Oshikoya mentioned in terms of really emotional intelligence, it begins with that self-awareness, right, of how you are, how you're feeling, and managing that, and being aware of how others are and managing your social relationships. So we're really focusing on personal and interpersonal skills to begin with for our students.
Excellent.
Yeah. And I think, one of the things we talked about was like making sure that they understood different perspectives and being able to see any one situation from different points of views. And one of the things that Dr. Minkus had mentioned is, as physicians and as sometimes medical students, we don't see ourselves as leaders, but realizing and recognizing that these are skills that can be built, that can grow, that can be taught, that we can practice. And as we practice and take it one step at a time, we can get better at it.
Excellent. Great. Yeah. And so I heard a lot of things in there, like, certainly for Dr. Minkus talking about self-awareness, kind of knowing, yourself as a leader. I heard from Dr. Osakoya some of that flexibility, which are also core competencies for a leader. I did hear a little bit about, styles, right? Leadership styles, and which I think is interesting. And I see sometimes a lot of young leaders, they tend to gravitate towards areas of power that would necessarily influence change, right? Which I guess by definition, leadership is behaviors that lead to change in attitude or behaviors, right? Is really leadership, the definition, or at least one textbook definition of leadership. Although Maxwell's definition is, look behind you. If you see people following you, if you're a leader, if you don't see any, you're just taking a walk, right? So, but I think that's interesting. But as far as leadership styles, there's certainly some leadership styles that work well, I think, in certain circumstances, and then there's others that don't work as well. And I think that sometimes, when I first see people go into leadership, they have a tendency to go into more of autocratic leadership styles, which, doesn't really, long-term wise, it doesn't really have the good outcomes. And I don't think that's what folks are expecting from leaders today. And then, I see other folks that are, may have more laissez-faire leadership styles too. Okay, well, whatever you want, as a team, that's fine with me. And that's not really, that doesn't really get satisfaction, or I'll see some young leaders that, want to have more of a bureaucratic process and, just, policies or whatever. And that can be frustrating. But, of everything I've read, it's like, in terms of leadership styles, it's more of a servant leadership approach that has a tendency to have some of the best outcomes. But I don't know, when you guys get into leadership styles, do you talk about that in the leadership training, or is that sort of a goal of leading them towards one leadership style versus another?
So where we are with the students right now, it's centered around really behavioral and choosing how they want to be. They get elements of these without us having to define it for them. So as we know, that's like the discernment factor. How do you know which style to use when? Even though we know, laissez-faire is not an effective leadership, or autocratic might not be, there are times for those things. So when you have a full spectrum of knowing when it needs to be laissez-faire, or a transactional situation, or transformational leadership, which really is one of the most evidence-based styles, where I always I like to bring that up, because it's not just the components that we think about. Transformational leadership is tied to outcomes as well. And so where we are in healthcare, we lead up to that. And I always bring up with wherever I'm coaching or consulting and with the students, that when we are talking about these leadership styles and qualities, it always seems like common sense, yet others don't see it from us in the behaviors, and our teams don't see it, and the organizations we work with and work for sometimes don't see it. So bringing it up in a way that they can experience what's impactful, and working with each other, we can fill in the specific aspects of it. Here at OCOM, we do, all of OCOM, we talk about our mission, vision, and values, which lends itself to really servant leadership and democratic style. And then when we tie it to the outcomes and what we're expecting, that really is transformational leadership approach. So being able to do that and to develop the skills to not just inspire but empower others, I think that really encompasses what we're trying to achieve with the students.
Yeah, I agree, absolutely. I think, the right leader can also be adaptable to the situation that's at hand, and be able to use different, aspects of different types of leadership to get across the mission that's at hand. I think we definitely here at OCOM want to serve our students and the faculty, and really exhibit a servant type of leadership here. And, I think the essence of, all of it is really when you have a really good team, building the right team to get through the mission, then we really are able to ensure wellness, and which is part of our core values here at OCOM, and making sure that we're serving um, all of the members of our OCOM family in that way to ensure that their wellness is first and foremost. And we all are excited to get to the finish line to achieve our mission.
Excellent. Great. Well, thank you. I appreciate that. And I also appreciate what you said about, transformational leadership, which, of course, transformational leadership, at least in my understanding, is that, trying to get folks to buy into the bigger vision, right? The bigger, the mission, things are bigger than us. And I always, reflect back on Daniel Pink's book, which we actually read as part of the Dean's Council, I don't know, last year or whatever, Motivation 1.0 was, running away from the lion or whatever, back in ancient times. Motivation 2.0 is more of that carrot stick motivation when you're trying to do things, based upon, some reward, right? More like a risk reward. So, the example I always think of is my brother, who's a car salesperson, right? In the car sales business, that's heavily driven by a carrot stick. And then, of course, Motivation 3.0, which Daniel Pink argues that is the strongest long-term motivator for human behavior, is when people are doing it for things that are bigger than themselves, the mission, the vision, so say for instance, or, religion and those type of things, and for us, at least, to me personally, I mean, training the next generation of physicians, the difference that we're going to make, by training excellent physicians. I mean, they're going to, survive us for, way after they're going to be taking care of us one day, and long after we're gone, they're going to be, taking care of the next generation of patients, and extending it forward. So, to me, that's a very positive motivation. And I agree, when you focus on things like that, and you can get, the team to, buy into some of those bigger pictures, I think the sustainable long-term outcomes for the, for the behaviors is going to be so much better.
Yeah, no, I love that, because that gets to the heart of what I do in coaching. Is most of us, as we talked about the core skills, we share some pretty important core values. So when that's not coming out in our behaviors, most of us want it to be a little bit different. And so being able to do that and then sort of align that, our own personal sort of values and mission and purpose to what we do, is incredibly impactful for really ultimately our patients and their families and the communities we serve, not just the organizations we work with and work for. So I think that's really a large aspect of what motivates all of us and our future, physician leaders.
Yeah, excellent. Now, one of the things, and I'm so inspired that we're doing this for, the medical students, and I know that we're also, going to be rolling this out to faculty and staff, over time, just because there's so much incredible interest in leadership. And I guess one other definition of leaders are that leaders make other leaders, right? So if we can, get other leaders, that is, an admirable trait, and folks really want to go into leadership. And then I hear from docs all the time, they're out in private practice, and sometimes they reach out to the medical school, for opportunities, or they really just, they want to, get into leadership positions one way or the other. What advice would you have to, say, physicians who really have that interest of growing their leadership skills, expanding? Maybe it's that physician out in private practice, maybe it's someone that's, working for a hospital or healthcare system. What would be the best approach for them? With similar backgrounds of us, that we never had any formal training when we went to medical school.
I think one of the big things is, mentorship, really leaning on mentors that you appreciate their leadership skills, and that you've observed and want to model yourself after. I think getting formal leadership training is important. It's important to understand yourself and have that self-awareness that Dr. Mink has talked about, understanding where your strengths and your weaknesses are, really being able to build upon your weaknesses and leverage your strengths so that you can be effective in what you want to do. And also having people around you, like your mentors, that are going to give you feedback and really help ensure that you're seeing the full picture.
And I liked how you said modeling too, right?
Yeah.
That's one of the fastest things to learn a new behavior, a new skill is to model after other folks. And heck, we've always sort of done that in medicine,
Mhm.
right? We would spend time with the attending physician as medical students or residents. Yeah, I'll never forget, I had this one attending physician I was spending time with, and I would, try to model all my behavior each rotation on my, attending physicians or physicians or a physician or physicians. And I had this one attending, and I came home one day and spent some time with my brother. He says, "Looks like you're walking with a limp or whatever." I'm like, "No," and it was just my gait was a little bit off, and I'm trying to think. I said, "No, I don't think there's anything." And I realized that I was modeling my attending physician who had a sort of an intelligent gait, and but I'd modeled him to such an extent that I was modeling everything. Not only how he was interacting with patients and how he was taking care of
Wow.
certain situations, but I was physically even sort of modeling
Wow.
him just because I had so much respect
Mhm.
and everything. So, but yeah, it's one of the fastest ways, right? If you want to do something, in public speaking, some people say, well, how can I get better at public speaking quickly? Just model your behaviors, and I think that the same is probably true with leadership, right? You
Totally.
find that mentor that you like, and
Mhm.
you see how they lead and how they interact, and certainly the students can get better role models than either one of you in terms of leadership. So yeah,
Thank you.
so 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 great. So let me ask you a couple other things. What do you think? How do you think leadership is going to change in the future? In terms of because I see the folks that are in healthcare right now much better leaders than they were previously. At least it seems like the skills are better in terms of leadership. It seems like more people have leadership skills than ever before, and it seems like that's improving. But how do you think things are going to change over time?
Well, I mean, I think that there's going to be technology is going to really drive that, right? AI and the all of the different tools that we now have to be more efficient and give us, quote, the answers to certain things will really make the human aspect of leadership important, right? It'll make what we just called the soft skills, the core human skills, right? A lot more important as we move forward into society. And I think also that just the new generation, they expect differently, right? They have different expectations that will drive change in how we lead and how organizations and companies treat employees and work with employees. And
Yeah, I agree with that human connection. I mean, it's such a fundamental part of being human, and we know what the pandemic did. And even, I recognize in our students and in most of us who've gone through that, or you were in an administrative role, you lost contact and got used to it, and it's not beneficial for what we do. So, uh, finding our path forward together in a collaborative fashion is a real great opportunity. So, as we grow as leaders, and we're all lifelong learners and students of leadership more than anything, and we live it and embody it, that's a real opportunity to do that. And it's sometimes just simple skills in terms of recognizing each other, having incredible partners and teamwork in that, and managing each other up. And we're fighting against a lot of incivility, negativity, bias in some respects, and we have this just real opportunity to leverage these incredible technologies and leverage each other
Mhm.
and all aspects of what that can mean.
Yeah. Now, and by the way, and I appreciate that, and I want to come back to it. Dr. Osakoye, you mentioned AI and leadership, and I think coming into today, I didn't even think about artificial intelligence and leadership, but
Yeah.
but heck, I'll tell you, I use AI all the time.
Mhm.
Writing letters of recommendation and stuff. I
Mhm.
had to do one last week, and it's beautiful. I've done this many times. It writes these beautiful letters of recommendation, which I guess that's one of the core competencies of a leader, right? Writing letters of recommendation. At least it seems like it. Heck, we have a leader, here at OCOM, and he's told me, about this, that he does this all the time. That if there are emails or whatever he's sending out, he'll have the AI kind of soften it a little bit. And I think that's actually in some new release of iOS where you can actually press a button and like on your iPhone, if you're writing an email, that it kind of can soften the language, or if you want to make it more professional or or less formal and stuff like that. So thinking about that, right? Back to your core human behaviors, right? You can sort of have some of that emotional intelligence kind of automated for you a little bit, although it doesn't really work on the fly, and
Right.
at least now, right? Maybe in the future. So now, and Dr. Minkus, you mentioned, about, I mean, people sometimes talk about, there's perhaps more cynicism now than there ever has before, and I don't know if that's necessarily true. It does seem like we do have a perpetual problem in society right now, that we do have a lot of more mental health challenges than we've ever had before. More people seeking psychiatric care. Although it's good that they're seeking psychiatric care, but one of the concerns is there more depression? Certainly from a physician standpoint, a few years ago, the statistic came out: the majority of physicians in America have at least some of the criteria for burnout, and of course, as leaders, sometimes you're working and you're trying to change your team so that there isn't as much burnout, right? You're trying to avoid a burnout from your team, and of course those are certain challenges, and of course trying to get have great gratitude and happiness infused within the organization sometimes is not ever so easy. But I know that Dr. Minkus, I know you've done a lot of work on physician burnout and trying to improve that and the leadership, which can be very challenging, right? So I don't know if you want to talk about that.
Yeah, and I'll just talk about, this is where the coaching approach comes in. And if we think about it, I mean, physicians in our training, we've all worked really hard, right? We've gone from being tired and it feels rewarding to tired and it feels threatening, right? So something's changed in there, and there's a whole lot of things. And when you were talking about mirroring a mentor, right? That's empathy in action, and your mirror neurons, and there's our whole nervous system's wired a certain way. And what we do in terms of leadership and burnout is not telling people what to do, not telling them what they should do, but working towards identifying the small steps that can change our relationship to the situation. And what's beautiful about being able to work in a medical school with our amazing young physician leaders or newer physician leaders, they can go into a system and have a different relationship to it. So that immovable object or some of the things that are there, they can understand that I'm going to go work for an organization and I'm required to do things that has nothing to do with the organization but a federal law or something. And so being prepared to look at a situation, to Dr. Oshikoya's point, that's the emotional intelligence. I might feel a certain way, I might react a certain way, but building that capacity to be protective of ourselves and of our teams and each other and our patients, that really is the first step. And I think that's the approach that we take. And when Dr. Oshikoya and I, before the end of the year, sort of shared our vision for the coming year, and it was actually Dr. Oshikoya who shared that vision of that and the positivity. And I was like, I would follow you to the end of the earth, with that, because that's how we get there. Yeah. So those things, those little small steps can make a big difference.
Yeah. Well, speaking of positive leaders, again, we have two of the most positive leaders that that I know, and we're so blessed to have both of you here at OCOM. And thank you for all you're doing, and thank you for this incredible leadership training that you're doing for our medical students. I think that's going to be incredible. So happy, and I'll look forward to seeing where it goes. Right, seeing the outcomes. From not only years from now, from decades from now, in terms of, you're planting the right seeds, giving the right skills to the right people. So anyway, well, thanks again for being on the show today. It's, any last words from either one of you?
No, thank you for having me. It was a pleasure having this conversation with the two of you.
Yeah, thank you. It's been a great dialogue.
All right. Well, thanks again, and thanks for joining us again on the OCOM Podcast, Modern Medical Education. And please join us again for our next episode.